Hi everyone, I'm Dr. Neha Dunn. I want to talk to you today about food allergies and food sensitivities. I'm a board certified allergist and immunologist, and I see a lot of patients who come to me wondering if a food is causing their symptoms. And they're not sure if they have a food allergy or a food sensitivity, or what the difference is, or what testing is available, and it can be very confusing. There's a lot of medical misinformation out there. So I really want to clear that up and delve into it a little bit further and talk to you about the differences and what testing that I would recommend. Let's first talk about food allergies because that's my area of expertise. So if you're allergic to a food, what happens inside your body is that you have preformed antibodies called IgE, and when they're exposed to that food protein, you'll have an immediate reaction. This reaction usually happens within minutes to a maximum of hours. So you will not have a food allergic reaction days after you ate the food. The food allergic reaction is also pretty quick. It's acute, so it'll last no longer than 24 hours typically. So if you eat a food and have a reaction, you won't react to that particular food for weeks after that exposure. The food reaction that you're looking for could be hives, it could be itching of your mouth, tongue, throat, itching of your whole body, it could be facial swelling of the lip, tongue, throat, eye, or ear, it could be coughing, wheezing, chest tightness, asthma type symptoms, especially if you have a history of asthma. And worst case scenario, it could be lightheadedness and dizziness because your blood pressure drops and you may even pass out. That's called anaphylactic shock, and that's when you need an EpiPen. Food allergic reactions don't mean that sometimes you can eat the food, but other days you can't. They just don't work like that. That allergy antibody, it's preformed, it's in your body, and it reacts right away. So what if you think you have a food allergy, but you're not sure what to do? It's a really good idea to go to your local allergist. So we have a quick in-office test where a dilute watered down form of the allergen is placed on your skin. You wait 15 minutes and then we measure for redness or swelling. And if it's positive, it'll look like a little mosquito bite or a hive that goes away throughout the day. And if it's negative, your skin looks normal, and it's quick, easy to do, and it'll give us some answers right away. The ideal test is something called a food challenge. That's also done in a monitored, safe setting at an allergist's office, and we actually give you the food that you're allergic to in very tiny doses in a very safe amount, and we increase that dose every 20 minutes until you get to a serving size. Once you've reached a serving size, we watch you for a full hour or two to make sure that you don't react. So let's talk about a food sensitivity because that is what a lot of people are interested in. And I think that's one of the most confusing terms out there because food sensitivity, it's not well defined. It's this vague umbrella term that refers to non-specific lower GI symptoms of nausea, bloating, abdominal cramping, gas, diarrhea, foods that don't sit well in the GI tract. So my first recommendation for somebody who has a lot of GI symptoms, you really should see a gastroenterologist. You really want to rule out whether you have some kind of inflammatory or autoimmune condition like Crohn's disease, ulcerative colitis, celiac disease. Those diseases require more intensive treatment. Some people, after all of that, are left with having irritable bowel disease or non-celiac gluten sensitivity or SIBO, which is small intestinal bowel overgrowth, or some kind of vague functional bowel disease. And for those patients, I think it is appropriate to look at your food and your diet and see what you could be doing differently. So with food sensitivities, I have a few do's and I have a few don'ts that I'm going to go through with you. The first don't is do not get food sensitivity testing. It has not been validated. There's no consistent evidence-based results that show that food sensitivity testing is actually accurate or helpful. It's also not FDA approved for that very same reason, which means that you will pay out of pocket for it. Aside from the cost though, the results are misleading. They're looking for an IgG antibody to foods. And if you remember from earlier, it's the IgE antibody that binds to food proteins that causes a food allergy. Not to get too scientific, but the IgG antibody is really important for immune memory. So what that means is it's going to recognize a food that we're tolerant to, that we've seen before, that we know, and you'll have elevated IgG antibodies to those foods. So it in no way, shape, or form is going to help you figure out what foods you can and cannot safely eat. What are the do's? What can you actually do if you think you have a food sensitivity? Because that's really what you want to know, right? So the first thing I would do is a food diary. And I know this can seem really tedious, but what I mean by this is if you're somebody who has episodic symptoms that happen once a week or a couple times a month or every few days, then I would write down what food you ate that day, specifically what you ate immediately prior to those symptoms, and look for a pattern. You may find that every time you eat out, every time you eat fatty foods, every time you eat carbonated beverages or red pasta sauces or wine or chocolate or certain food groups, that you're having your symptoms. And I've actually seen a lot of patients who have just cleaned up their diet. They've eaten more natural foods, cooked more at home, which is healthier on so many levels. And they've felt a lot better from a GI standpoint. So I would keep a food diary and I would look for any kind of cause and effect relationship between certain food groups and your symptoms. Now, if you're somebody who's done that and haven't seen a pattern, or you just have daily symptoms and there's no rhyme or reason and you're not linking it to a specific food, then you might want to try an elimination diet. So my recommendation, and this is my second do, is try a gluten and dairy-free elimination diet. And I say that because lactose intolerance is very common in the population. It affects up to 60 to 70% of people, and it can cause a lot of lower GI symptoms. And also there's a condition called non-celiac gluten sensitivity, where gluten, too much of it, can really irritate the GI tract, and people feel a lot better by just eliminating it. So if you eliminate those two food groups and you feel a lot better, then you know that one or both of them was triggering your symptoms, and you kind of continue down that path. Okay, the third recommendation or do that I have for food sensitivities is to consider the FODMAP diet. FODMAP stands for fermented oligosaccharides, disaccharides, monosaccharides, and polyols. So don't worry about that big long name. Just remember FODMAP, FODMAP. And this is a diet that focuses on eliminating certain short chain carbohydrates, so certain sugars that don't digest well in the small intestine. And by eliminating those, it can improve a lot of symptoms. And some studies have shown it improved 60 to 70% of patients with irritable bowel syndrome felt better when they did the FODMAP diet. And so it is certainly worth trying. I'm going to make a video specifically on the FODMAP diet that breaks down high FODMAP foods, low FODMAP foods, and the 3 steps in doing it, which involve elimination, reintroduction, and customization. But it's a great diet to consider if you're still struggling with those food sensitivities. And that's all I have for you today. If you like the video, please click the like link below and have a great day.